Welcome to the presentation on the International Dysphagia Diet Standardization Initiative, better known as IDDSI. My name is Diana Kirakosian, and I'll be guiding you through this framework that helps us provide safe, consistent, and person-centered nutrition and hydration for individuals with swallowing difficulties. The goal of this presentation is to give you a clear understanding of what IDDSI is, why it's important, and how we can apply it in our daily practice to support resident safety and quality of life. Signs and symptoms of dysphagia. Dysphagia can lead to malnutrition, aspiration pneumonia, choking, and death. Adults experience dysphagia due to various etiologies, which manifests in numerous symptoms. Some examples include avoidance of certain food textures, like dry, crumbly, or thin liquids, fatigue during meals, taking unusually long to finish eating, frequent throat infections or aspiration pneumonia, unexplained weight loss or dehydration, coughing or choking during or after eating or drinking, throat clearing while eating and drinking, wet or gurgly voice after swallowing, difficulty chewing food thoroughly, pocketing food, drooling or leaking food liquid from the mouth, needing extra time to chew or swallow, feeling of food sticking in the throat or chest, and pain when swallowing. It is very important to note or understand these signs and symptoms so that you will be able to report it to the provider or the licensed nurse. Texture in diet. There are various diet textures that can impact individuals with dysphagia and their swallowing ability. Let's explore the options available through the IDDSI framework. It's important to note different methods can be used to prepare foods at the desired consistencies while maintaining their flavor. What is IDDSI? It's a global standard with terminology that describes texture-modified foods and thickened liquids for all ages, cultures, and across all care settings. It utilizes universal terminology and testing methods. It helps improve resident safety and communication among staff across care settings. Now, on the left, you can view the diagram of the IDDSI food and liquid levels. It's important to note that the inverted triangle shows levels of solid foods and the upright triangle shows levels of liquids. Each level has a number, name, color, and description. The overlapping number of 3 yellow and 4 green can be used for both food and drink. Let's continue with what IDDSI is. This expansive and detailed framework of diet levels is intended for all cultures to streamline terminology and reduce error and confusion. It also will help with proper coding and identification. IDDSI consists of 8 levels 0 to 7, along with numbers, colors, descriptions, and testing methods for foods and liquids. So why is it important to use IDDSI? Well, over 17,000 people die due to aspiration pneumonia each year. And of those, 13,000 are adults over the age of 74. Approximately 3,000 people died from choking in 2020. This included more than 1,400 adults older than age 74, who typically choke on food. Choking is the 4th leading cause of death due to unintentional injury. Lastly, approximately 1 in 6 adults report swallowing difficulty. And the main goal of IDDSI is to encourage resident safety. Now, standardizing descriptors, terms, and measurements of solid and liquid diet levels can assist in reducing the risk of choking and aspiration. These standards are especially important for residents with oropharyngeal dysphagia with the goals of maximizing safety and minimizing negative effects of inappropriate diet recommendations. So before the introduction of IDDSI, many facilities followed the National Dysphagia Diet. The NDD is a 4-level diet that has less specific and more subjective definitions. The National Dysphagia Diet also has fewer testing tools to determine the appropriate level of food and drink items. Inconsistent interpretation and facility-specific modifications to NDD terminology and diet items created variability across the facilities and individuals. For example, one facility may have called a level A ground diet, while another referred to the same level as mechanical soft. When residents were transferred between those two facilities, errors were likely to occur, putting the resident safety at risk. Dysphagia clinicians may have used one set of terminology, while registered dietitian, nutritionists, and or kitchen staff may have used another. Here are the levels of the IDDSI framework. We have level 0, thin liquids, level 1, slightly thick, level 2, mildly thick, level 3, moderately thick or liquidized, level 4, pureed, extremely thick, level 5, minced and moist, level 6, soft and bite-sized. Lastly, we have level 7, we have 2, level 7 regular, and level 7 easy to chew. Of course, with the adoption of the IDDSI framework, we have updated the diet order and communication form to include the correct texture modifications and liquid modifications. We're going to discuss each level in more detail. So here's level 0. It's considered thin liquid, and characteristics include flows like water. It does have a fast flow, and you can drink through any type of teat, nipple, cup, or straw, as appropriate for age and skills. Here are the characteristics for level 1, slightly thick. It is thicker than water, still able to flow through a straw. Certain beverages are slightly thick, like fruit nectars, nourishments. And it's important to note that the IDDSI flow test, which we're going to talk about in detail soon, is between 1 to 4 mLs remaining in the syringe after 10 seconds. Here are the characteristics for level 2, mildly thick, currently known as nectar thick liquids. And the flow test, again, that we'll discuss shortly, is between 4 to 8 mLs remaining in the syringe after 10 seconds. Solid foods and overlap. IDDSI solid and liquid levels are distinguished by name, color, and number. Liquids are levels 0 through 4, and solid foods are levels 3 through 7. Levels 3 and 4 overlap between solids and liquids. Level 3, moderately thick or liquidized, currently known as honey thick. You would use a flow test, and after 10 seconds, you should have about 8 to 10 mLs remaining in the syringe, which we'll discuss shortly. The fluid drips slowly and dollops through the fork's prongs. Here are the characteristics of level 4, pureed, extremely thick. Usually eaten with a spoon, a fork is possible. It cannot be drunk from a cup because it does not flow easily, cannot be sucked through a straw, does not require chewing. Can be piped, layered, or molded because it retains its shape, but should not require chewing if presented in this form. It shows some very slow movement under gravity, but can't be poured. It should fall off spoon in a single spoonful when tilted and continues to hold shape on a plate. It should not have any lumps, shouldn't be sticky, and lastly, liquid must not separate from solid. What are transitional foods? The term refers to specific items in levels 5, 6, and 7 that start in one solid form but change when water or saliva is added or temperature is changed. You may use these foods to prepare or transition residents from one solid diet level to the next. Because they require limited chewing and rely only on the tongue's strength, they are easily broken down and can be used to teach chewing skills. Examples include cheese puffs, potato chips, or ice cream sandwiches. Now, proper testing of the items believed to be transitional is required, as explained in future section. Here are the characteristics of level 5, minced and moist. It should be soft and moistened, easily mashed with fork, no separating thin liquids or liquid dripping from food. Requires some chewing. Here are some examples of foods to avoid if resident is level 5. Hard or dry foods, crunchy and crispy foods. Another good example is raw vegetables, but this has a more comprehensive list. Others are sharp or spiky or crumbly bits, for example, should be avoided if a resident is at level 5. Level 6, soft and bite-sized. It can be eaten with a fork, spoon, or chopsticks. It can be mashed, broken down with pressure from fork, spoon, or chopsticks. A knife is not required to cut this food, but it can be used to load a fork or spoon. It should be soft, tender, and moist throughout, but with no separate thin liquid. Chewing will be required before swallowing. Bite-sized pieces as appropriate for size and oral processing skills. For adults, it would be 15 mm or 1.5 centimeter pieces, no longer. A few things to consider for level 6 with specific food items. Do not serve regular dry bread. Meat should be cooked tender and chopped into 15 mm or 1.5 centimeter pieces. Fruit should be soft and chopped into 15 mm pieces. Vegetables should be steamed or boiled and cut into 15 mm pieces. Lastly, rice should be moistened, not sticky, and not separating into individual grains. Characteristics of 7 easy to chew. Normal everyday foods of soft, tender texture that are developmentally and age appropriate. Any method may be used to eat these foods. Sample size is not restricted at level 7. Therefore, foods may be of a range of sizes. Smaller or greater than 8 mm for pediatrics, and smaller or greater than 15 mm for adults. Does not include hard, tough, chewy, fibrous, stringy, crunchy, or crumbly bits, pips, seeds, fibrous parts of fruit, husks, or bones. May include dual consistency or mixed consistency foods and liquids, if also safe for level 0, and at clinician's discretion. If unsafe for level 0, then liquid portion can be thickened to clinician's recommended thickness level. Lastly, let's talk about 7 regular. It's normal everyday foods of various textures that are developmentally and age appropriate. Any method may be used to eat these foods. Foods may be hard and crunchy or naturally soft. Sample size is not restricted at level 7. Therefore, foods may be of any range of sizes. Includes hard, tough, chewy, fibrous, stringy, dry, crispy, crunchy, or crumbly bits. It can include foods that contain pips, seeds, pith, inside skin, husks, or bones. Lastly, it includes dual consistency or mixed consistency foods and liquids. Thickening agents. Powder and gels may be added to liquids to change their properties, and pre-thickened liquids are also available. Thickening powders and gels may contain different thickening agents, such as cornstarch or xanthine gum. When deciding whether to use a thickening agent, consider the product being used and the item being tested. Different fluids thicken differently depending on base liquid, thickener type, thickener brand, temperature, and time. So which thickening agent is recommended? Actually, gel thickening agents are preferred and highly recommended over powdered thickeners because they provide consistent viscosity, dissolve evenly without clumping, they maintain their thickness over time, and cause minimal change to the taste. This in turn supports overall improved quality of life. General considerations for testing include: each diet level has specific testing methods to use. Food and drink properties can change with their temperature, whether it's hot, chilled, room temperature, which affects consistency and resident safety. Test solid and liquid items not only at prepared temperatures, but also again at serving, since there may be a 15-minute or longer delayed serving or distribution of food trays. Manufacturers of thickening agents or pre-thickened liquids should recommend the ideal serving temperature. If a food or drink item does not test to an expected level, the kitchen staff may modify its preparation so that it qualifies. Now we're going to review all of the standardized testing methods for each level. The IDDSI framework of terminology and definitions includes an objective measurement for liquid thickness. The flow test classifies IDDSI levels 0 to 3 based on their rate of flow. So the flow test is used for levels 0 to 3. You want to use a 10 ml slip tip hypodermic syringe. Determine the IDDSI level by how much fluid remains in the syringe after it flows out for 10 seconds. Now, before you test, you must check your syringe length because there are differences in syringe lengths. Your syringe should look like this. You want to remove the plunger, cover nozzle with finger and fill 10 mLs. Release nozzle and start timer. You want to stop at 10 seconds and review how much fluid still exists in the syringe. Next slide is going to show you a video on just how exactly you would conduct the flow test.
Get a stopwatch and some 10 ml slip-tip syringes. Remove the plunger from one syringe and discard. Cover the nozzle of the syringe with your finger, making a seal. Fill the syringe up to the 10 milliliter line with fluid. It's recommended to use another syringe to do this. Remove your finger from the nozzle end at the same time as starting the stopwatch. At 10 seconds, replace your finger over the nozzle, stopping the liquid flowing.
Let's review the results of the flow test. So for level 0 liquids, you should have less than 1 ml left in the syringe after 10 seconds. For level 1, you should have 1 to 4 mLs. For level 2, you'll have even more because it gets thicker. So level 2 would have 4 to 8 mLs remaining. And the thickest would have greater than 8 mLs remaining in the syringe after 10 seconds. You will perform a fork drip test for levels 3 and 4. So you want to place the item on a fork and observe. For level 3, the items drip slowly through the tines of a fork, as you can see in the picture. So this would be level 3. Now level 4, which we'll get to see on the other slide, the item does not flow through the tines of a fork. So here's level 4. The item sits in a mound or pile above the fork. A small amount may flow through the fork and form a short tail below the fork, but it does not dollop, flow, or drip continuously through the fork prongs.
First, we're going to talk about the fork drip test. And for this, you obviously need a fork. And this evaluates how liquids flow or not flow through the fork tines. And we'll use this for level 3, level 4, and level 5. And I'll talk about all those levels. So first thing, the IDDSI fork drip test for level 3. You're going to scoop or draw the fork through the sample, and that evaluates the flow. A small amount will remain on top of the fork with no mounding, and it will drip slowly or in dollops through the tines of the fork. So this is for liquidized and for moderately thick. Let's watch a video that shows how this is done. So I want you to notice that the fork scoops through the liquid to take the sample. So you would not pour the sample on top of the liquid. This is how you would do it. You can see it dollops through the bottom of the fork and flows. You do the IDDSI fork drip test for level 4, and that would be extremely thick or pureed. The extremely thick liquid or pureed sits on a mound or pile above the fork. You may see a small amount flow through and form a tail below the fork. It doesn't dollop, flow, or drip continuously through the tines of the fork. And then the fork drip test for level 5. When the sample is scooped, it sits in a pile and it can mound. There will be nothing that's flowing or dripping through the tines, and this is for level 5 mixed and moist.
Here's the spoon tilt test for levels 4 and 5. You want to place the item on a spoon and see how cohesive it is. Tilt the spoon or turn it sideways to see how it leaves the spoon. A very gentle flick may be needed to dislodge the item from the spoon. The item should easily slide off the spoon with very little left on the spoon. You should see the spoon through any thin film that remains. It may also spread or slump very slightly on a plate.
Now we're going to talk about the spoon tilt test. For this, we need a spoon, and we're going to evaluate how a scoop of liquid or food falls off or doesn't fall off of a spoon. And this is used as a determination of cohesiveness and stickiness. It's used for level 4 and it's used for level 5. So some notes on the spoon tilt test. It needs to be cohesive enough to hold its shape on the spoon, but it should not be firm and sticky. A full spoonful must plop off the spoon if the spoon is tilted or turned sideways. A very gentle flick using only fingers and wrists, but not the arm, may be necessary to dislodge the sample from the spoon, but the sample should slide off easily with very little food left on the spoon. A thin film remaining on the spoon is acceptable, and you should be able to see the spoon through the thin film. The sample may spread very slightly on a plate. Now let's go back and talk a little bit about this gentle flick. So many people around the world are training their employees to hold their elbow firm with their other hand of their other arm. And that way, when they do the flick, they're only using their fingers and their wrists, and they're not using the whole arm. So that's one way you can train your employees. And now we're going to watch a video, and you're going to see how this is done. You're going to see a couple examples. So this is the spoon tilt test for level 4. And this one, look at that. That falls off the spoon, so that passes. This next one appears to be mashed potatoes. That looked pretty good. That came off the spoon. But look at this, too sticky. It's not coming off the spoon. So what that tells us is that a food may start off as acceptable, but as it cools or sits out, the acceptability can change. So it's really important that anyone assisting with feeding be aware of these potential changes and know how to spot the signs. And when appropriate, they may need to recheck the food.
The fork pressure test is used for level 5, 6, and 7, easy to chew. Let's discuss level 5 fork pressure test. Small lumps may be less than 4 millimeters wide and 15 millimeters long. Pressing a form against the surface makes the pieces come up through the tines. For fork pressure test for level 6, you want to observe the item when you press the tines against it with enough pressure for your thumbnail to blanch white. For level 6, it should change shape and does not return to its original shape. Bites should be no larger than 15 millimeters. Lastly, fork pressure test for level 7, easy to chew. When pushing down on sample with a dinner fork, with enough pressure that the thumbnail turns white, the food breaks apart and can be squashed and will not return to original shape.
Next, let's talk about the fork pressure test. We recommend a fork for this. Spoon can't be used, but is not recommended. You evaluate the firmness of the food sample by observing the reaction of a sample to pressure from a fork. You use this for levels 5, 6, and 7, easy to chew. For puree level 4, it is optional on the audit sheet, and we'll talk more about that in a moment. In this test, you press on a 15 by 15 millimeter piece of food with your thumb in the bowl of the fork, as shown, with just enough force to turn the skin under the thumbnail white or blanched. The food should squash easily and not return to its original shape. So to be acceptable, we do want to see the sample squashed, broken, and changing shape. And interesting, the pressure required to blanch the skin under the thumbnail is consistent around the world regardless of skin tone. It turns out that the pressure necessary to blanch the skin under the fingernail has been measured to be around 17 kilopascals, as shown on this IOPI device. It also turns out that the estimated average tongue palate pressure is 15 to 20 kilopascals. So when you're doing the fork pressure test, as shown on the banana sample here, we actually are simulating the pressure that is relevant to the oral motor processing pressures that are generated in the mouth. So now let's watch a video of the fork pressure test. We're going to do level 6, soft and bite-sized, and we're going to use broccoli. So first is the fork. So you'll see that that first test, that broke, so that's passed. Now also notice these are 15 by 15 millimeter samples. You can see the measurement. This one, it deformed, but it didn't squash, so that did not pass. Now let's look using chopsticks for the fork pressure test. So this first one, that appears to squash pretty easily and it breaks apart. So that would pass. And let's look at the second one. So that doesn't appear to be squishing or squashing very well, and it does not pass. So now we'll do the finger test for the fork pressure test. This first piece of broccoli, that appears to break apart pretty easily. And let's look at the second one. That one doesn't break, and it looks like it needs to be cooked a little more to get to the correct softness. Also, if you use your fingers, you really need to learn how much force is needed to do the finger test.
Lastly, you want to use the fork-spoon separation test for level 7 easy to chew. So basically, it's important to note that level 7 requires the fork-spoon separation test and the fork pressure test, which we discussed earlier. For the fork-spoon separation test, the food breaks apart easily using the side of a fork or spoon. Some fish and chicken may pass this test, but most meats will not.
Next is the fork-spoon separation test. You need a fork or a spoon for this, and you evaluate the ease with which food is able to be separated into smaller pieces by oral processing. And this is used for level 6 and level 7 easy to chew. To do this test, you use the side of a fork or a spoon to attempt to cut through the food with no more force than it takes to blanch the fingernail. Food that can be separated with this gentle force will meet the standard.
Transitional food test. What you want to do is add 1 milliliter of water to a 1.5 by 1.5 centimeter sample and wait for 1 minute. Then you want to use the fork pressure test to ensure the item is soft enough and does not regain its shape.
Final test we're going to discuss is the transitional foods texture assessment. We use a fork and a little bit of water to simulate the effects of putting the transitional food into your mouth and exposing it to saliva. This is a test that is only used with transitional foods. So we're going to take a 15 by 15 millimeter sample for the food to be tested. So you need that size for a sample only. Transitional foods can be served in any size that's judged appropriate for the individual, but we're going to take the standard sample. The sample is wetted with a standard amount of liquid, which is 1 milliliter of water. And after 1 minute, you basically perform the fork pressure test on the sample. You push down on the sample with a fork until the thumbnail blanches. The sample should be squashed or fractured and does not return to its original shape.
Now we're going to review some of the challenges you may face during the implementation of the IDDSI program. Challenge number 1, clear liquid diets. Residents may require specialized diets such as clear liquids. Items that are safe for the specialized diet like clear broth or soup, juice without pulp, or strained vegetable juice may not be appropriate for those with dysphagia since they fall within level 0. Before an order is placed for a clear liquid diet, the team should consider the resident's recommended diet level. Input from the dysphagia clinician is helpful before initiating clear liquids so that the diet levels coincide with medically necessary diet recommendations. Challenge number 2, resident and family pushback. Change can be hard for many people, especially those who have been living in a facility with the same diet for many years. Education will be particularly important for these individuals and/or family members. Although some residents may have minimal change to their diet or may see a change for the better, assure everyone that this change is for resident safety. Additional items can be added after testing with the dysphagia clinician. Remember, it is ultimately the decision of the resident to follow the recommended diet. Challenge number 3, questioning correct level. Certain items may create more discussion or debate as they may be perceived as one diet level when they are classified as another. Here's an example. Say a family member complains to the RD that their parents should be allowed peanut butter on their level 4 pureed diet. They say peanut butter is pureed item due to its consistency and properties. The RD explains the pureed testing method and shows that peanut butter does not plop off the spoon when tilted sideways in the spoon tilt test. Additionally, it leaves more than a thin film on the spoon after the test than is acceptable. The RD also checks with the dysphagia clinician to determine whether this resident can safely swallow peanut butter. Education and testing are the keys to alleviating this type of debate. challenges continued, requesting non-approved item. When residents request non-approved items, involvement of the dysphagia clinician is necessary. They must assess the resident to determine if the desired item is safe under all circumstances. IDDSI is designed to standardize care and communication for resident safety, but some modifications can be made under the care of a proper professionals. Consider the following scenario on the next slide. Let's consider the following scenario. All residents in your facility who were previously on a mechanical soft diet are now on level 6, soft and bite-sized, since introduction of IDDSI. This means that all people who previously got soft sandwiches or lightly toasted bread no longer do. Many residents do not miss the bread products on the level 6 diet, but several are unhappy about the change. You can trial these residents on an upgraded diet of level 7, easy to chew, and or evaluate them with specific items such as bread and toast to determine safety. You consult with the RD and kitchen staff to understand how much the bread is toasted. Once this is determined, the medical provider writes an updated order that states, Level 6, soft and bite-sized diet with the addition of sandwiches, including grilled cheese and toast. Level 1, slightly thick liquids. Therefore, even within a specific order for a specific level, certain accommodations can be made with the involvement of the IDT. Discrepancies in terminology and actions. Education and team consistency are important for a successful launch and continuation of IDDSI. When team members are not consistent in ordering or using new terminology and recommendations, it will compromise effectiveness and resident safety. Collaborating with your entire team includes the RD, kitchen staff, dietary aides, nursing staff, resident care technicians, therapists, and many more. Lastly, it's important to note that education, collaboration, and preparation time before the IDDSI launch will contribute to the success of the program. In conclusion, now that you've finished viewing the course content, you should have learned the following: descriptions of each IDDSI food and drink level, and one testing method to confirm each level. You should have learned why the IDDSI framework is important and the steps required for implementation. Proper testing of liquids and solids is essential for the accurate categorization of all items in your setting. Use the flow, fork drip, spoon tilt, fork pressure, and fork separation tests. Follow IDDSI guidelines to complete and interpret each testing method. And when challenges are encountered, particularly before and in the early stages of IDDSI implementation, refer to the resources on IDDSI's website or your resource binders. Timely and thorough education is a key factor in combating many of these objections that you will encounter. Please look for your IDDSI resource binder because it has lots of valuable information about IDDSI in the program. It has competencies, notification letter, implementation checklist, audit tools, quick reference guides, and many, many more. For all IDDSI-related questions, please contact Patil Malatian, who's our SLP consultant for Northern and Southern California, Donglim Lee, who's our VP of Food Service and Nutrition, Hope Cook, Freshta Sadiq, Carmen O'Connell, and Ellen Francis, based on your region.